Hi everyone, my name is Jasmine Parker, and I decided to do my research presentation and project for diabetes. I chose diabetes because my grandmother has diabetes, and she's had it for a long time now. And she would always ask me to give her massages and stuff. She's really the reason that I started to do massage therapy. Diabetes is something that's very prevalent in my household because my grandmother has it. My mother is at risk for having it. My great grandmother had it, and I have a lot of aunts and uncles who have diabetes. So it was really important for me to do this because it will also help me to help them with massage, and also it gives me like good case studies or whatever. And then I myself was at risk for being diabetic, so that's why it always hits home with me when I we talk about diabetes in class. So that's the reason why I decided to do this. After that little background or whatever, I'm going to get into my presentation. Diabetes is basically a metabolic disease in which the body is unable to produce any or enough insulin at all, and because of that, glucose levels drops in the blood, and it causes a lot of problems. So different things like insulin is needed, and that's basically the main thing because it's an insulin deficiency. Diabetes is broken down into two categories. That's diabetes mellitus and diabetes insipidus, which are two totally different things because diabetes mellitus is more of an insulin deficiency, while diabetes insipidus is more of a ADH deficiencies. Is more stuff wrong with ADH instead of there being stuff wrong with the insulin. So for diabetes mellitus, it's broken down into a couple of other categories, which is type 1 diabetes, type 2 diabetes, gestational, and secondary diabetes. For diabetes insipidus, you have central diabetes, nephrogenic diabetes, and gestational and disogenic diabetes insipidus. So just there showing you that it has different categories shows you that it's different things. They have two different things going on with the body. So for diabetes mellitus, I'm gonna go ahead and skip to type 1 diabetes. Okay, for that, it's also known as insulin dependent diabetes. It's an autoimmune disorder where a number of things like exposure to certain drugs and complications from other infections can cause diabetes, type 1 diabetes mellitus. Basically, the immune system cells of people with type 1 diabetes attacks beta cells in the pancreas where insulin is produced, which causes the patient to be insulin deficient. Type 1 diabetes is less rare than type 2 diabetes, and of any of the other diabetes. It accounts for 5% to 10% of diabetics in this country. Type 2 diabetes is more common because it's less life-threatening. It can be controlled with proper diet and exercise, and some anti-diabetes drugs help manage this disease as well. Gestational diabetes, which again falls under diabetes mellitus, is when a woman becomes diabetic during pregnancy. It can cause high birth rates. It is accounted for a lot of C-sections, and it can also cause birth defects within a child. A woman or their child has an increased risk of developing type 2 diabetes later on in life from having gestational diabetes. Secondary diabetes mellitus is when a person has had any trauma due to the pancreas or the endocrine system or any type of endocrine disorders like acromegaly and Cushing syndrome. A person is more prone to developing secondary diabetes. Diabetes insipidus is a problem in the brain or kidneys that leads to failure to concentrate urine properly. It is very rare, and it is usually linked to trauma or disorders as well. It is not related to diabetes mellitus in any way, as I have stated already. And unlike diabetes mellitus, there is no type 2, there's no type 1, and earlier I gave some the categories in which it falls under, which is central diabetes insipidus, nephrogenic diabetes insipidus, dipsogenic diabetes insipidus, and gestational diabetes insipidus. Also, I can go back to this. Well, I'll tell you the signs and symptoms usually for diabetes insipidus are frequent urination, thirst, the urge to pee in the middle of the night, and also bedwetting is common for adults. And signs of dehydration may develop, including sunken eyes, muscle weakness, hypotension, and rapid heartbeat and headache. That's usually how some people realize that they do have this disease. Some of the signs and symptoms that happen with diabetes mellitus, going back to that, is frequent urination as well, thirst, increased appetite, weight loss, nausea, and vomiting. The symptoms are very subtle and could be mistaken for any other disease, but if neuropathy, impaired vision, kidney dysfunction occur, it's easier to realize that this may be diabetes mellitus. People with diabetes mellitus, also going back to diabetes mellitus, they are more prone to cardiovascular disease, edema, ulcers, gangrene, amputation, kidney disease, and a host of other diseases, just because of that insulin deficiency and everything going on with the pancreas. It causes other things within the body. So jumping back to diabetes insipidus, I'll just give a little brief thing about each subcategory. So central diabetes insipidus is most common and occurs when there is a reduction to ADH production in the hypothalamus or reduction in ADH release in the pituitary. Nephrogenic is a problem with ADH sensitivity through the collecting tubules of the kidneys. Hypercalcemia and hyperkalemia are also causes of nephrogenic diabetes insipidus. Gestational diabetes insipidus happens when a woman is pregnant and placental enzymes destroy ADH in the mother. Unlike gestational diabetes mellitus, this goes away right after pregnancy. So right after you give birth, diabetes insipidus will be canceled out. But for diabetes mellitus, it's also the same way. It's just you have a more higher chance of getting diabetes, type 2 diabetes, but with insipidus, you won't have any problems developing diabetes insipidus throughout your life or the child's life. Dipsogenic diabetes insipidus is when there is too much fluid intake and then changes in the activity of ADH. Also, I was reading information on this, and they were just discussing how it could also be a psychological disorder. And when I talk about the treatments, it would, give you more insight on that and just explain what I mean by psychological disorders or psychiatric disorders. Treatment for diabetes mellitus has evolved over the years dramatically. Usually when it was diagnosed back, in the days, as people would say, it was harder to treat and it would also cause death. But now it is more treatable. Advances over the years have made it easier to treat and live with, so that's good. But type 1 diabetes is treated with various forms of insulin, whether it be injection, like an EpiPen, insulin pen, or insulin pump, which is connected to the person's body 24/7. I have a friend who has type 1 diabetes, and she has an insulin pump that is connected to her. I wasn't sure what it was when I see her, because when you see it, sometimes it may even look like a beeper, but it's connected to her body, and whenever her body tells her or whenever she feels she needs it, insulin is injected, it's released into her body, so everything's okay. Type 2 diabetes is treated with diet and exercise control and medications that manipulate how insulin is used. Diabetes insipidus is determined by cause. central diabetes insipidus is treated with a synthetic form of ADH. Nephrogenic is treated with drugs that can change the way the kidneys respond to ADH. And dipsogenic is treated with psychiatric interventions. Basically because, that fluid intake could be caused by a person's, psychological mind telling them that they need to drink more when they really don't. So that's how they treat that. Now for massage and how it is connected with diabetes and how it helps diabetes. Massage for a person with diabetes insipidus has no particular risk as long as he or she is controlled on the table. A client can enjoy all of the benefits like a regular massage client. Massage for a client with diabetes mellitus is a little different though. Injection sites and insulin pump attachments are local contraindications. Cardiovascular disease, kidney disease, skin ulcerations, and neuropathy all compromise body work. In addition, work should be timed. Work should be timed. Work should be timed around insulin dosages to avoid hypoglycemic episodes. It's also good to become familiar with signs of hypoglycemia and hyperglycemia so you know what steps to take to help your client. A client who has healthy tissue can enjoy the same benefits like any other client. Also, I wanted to go back to we had a speaker this semester talking about diabetics and diabetes, and so I took a lot away from that as well because it is important to know the difference between hypoglycemia and hyperglycemia because there are different treatments for that. One thing, you might need orange juice, or something else you might need sugar. So it's good to know so you have all of those on deck. And it's good if you know you're going to be working with people who have diabetes. It's good to be versed on it so that if something happens, you know what proper precautions to take. Also from the states that I did, I went on the American Diabetes Association, and they stated that there are a lot of direct benefits for diabetic patients. Massage near injection site has been noted to help insulin absorption. Uncontrolled studies suggest that massage may have positive effect on blood glucose levels and symptoms of diabetic neuropathy. Acupressure therapy lowers cholesterol levels, and hot stone massage has been said to help blood circulation. Massage is not a cure for any disease as well as diabetes. However, it can help a person. It could aid them, paired with healthy lifestyle and medication. It can be managed and maintained. And different modalities have been beneficial to diabetes with a number of studies done to prove this fact. To this day, studies are still being done to prove this point. And, diabetes is very common. It's happening a lot nowadays. So the more information, the better. And basically, that's all the information I have today. And so, thank you all. It's been a great semester, and I am done.